Hi, and welcome to another episode of Hot Takes with me, the Silver Fox. The first duty of any government is the safety and security of its people. That is the very first duty, be it defence of the realm for security, and then the safety aspect would be the health of the nation. It is not unreasonable to say that the NHS in Scotland is beyond fixing. It is at such a crisis level, a level at which it has never ever been before. It is so bad that it is crumbling before your eyes. It may only be a year and there may be no NHS in Scotland. It is completely that bad. There are many reasons, but most of them can be laid at the door of the SNP. Now there's a whole raft of things that are going wrong. We're going to concentrate on one, but I am going to mention a few others in passing. There's sort of a few things going, but rather than splitting them into separate videos, I'm going to combine them all in one video just to go and show you how awful it is and how you've really got to be very, very careful about the choices you are going to make when it comes to looking after your family. Before we get into this, I will say do please hit the subscribe button. It really helps the channel grow, and it's stories like this that need to be shown, need to go out so as many people as possible can be aware of them and to know exactly what's happening and never to believe the spin that the SNP are putting on this. Remember, the SNP are spending £8.5 million a month on spin doctors in the NHS to cover up stories like this. Or like these, in fact, several stories. But it is appalling. So do please hit the subscribe button and definitely like the video. It just gets the message out wider, further, deeper. More people see it, more people aware, and who knows, it may even save lives. Here we go. We'll have a look at the story, and it is appalling. Here goes. So the first of these three stories, they're all interlinked, but it's better to put them all as one. But the first one I just want to address is this: Scots face even longer waits for GP appointments under the SNP, and 1 in 4 doctors are considering quitting the NHS. 25% of all GPs in Scotland are about to leave because they cannot work under the pressure that they're expected to. There's no investment at this level. There's no investment in GPs. You need to at least double the number of GPs. Unfortunately, they're not. And GPs are actually having to turn people away off their books. There's people out there who do not have even basic access to the first line medical care that a family doctor, a general practitioner, offers. That is the state of Scottish NHS when you cannot even see a doctor. Not that you can't see one quickly, but where you cannot even register with one. And with 25% of them about to quit, this problem is going to get far, far worse. And you have to wonder how much £8.5 million a year that they're currently spending on spin doctors, how many more real doctors could that buy? A lot more, I think. It is a ridiculous situation to be in. Scots are facing the prospect of an even longer waits for GP appointments, as 1 in 4 doctors consider quitting within the next 2 years. Patients are already facing record waiting lists under the SNP rule, and thousands struggle to see their GPs face to face. Now, of course, if you're not investing in doctors and you're not providing enough GPs, then the people that are there are cramming into the ones that are currently there. GPs literally don't have the hours in the day to see the number of people who need them. While they're waiting, people aren't getting serious diseases picked up. Things like, for example, cancers. And by the time they do present and get hold of a doctor, it's often way too late. The NHS under the SNP is failing to such a degree that the SNP are actually causing the deaths of people because of their failure to provide basic healthcare. More than 2/5 of practices say they cannot meet the demand from patients, while 3 out of the 5 fear for the future of their practice if a GP quits. A survey by the BMA of GPs in Scotland found just 1 in 20, that's 5%, of those who responded believe their practice is long-term sustainable position. It's not only unacceptable, it's criminal. It's criminally bad. BMA Scotland GP Chair Dr Andrew Buist warned that the country is facing a bleak situation and called for urgent action from the nationalist government. He predicted Scotland could become seriously underdoctored. It already is. It is already underdoctored. People in the NHS in Scotland basically are leaving it and coming south and going into the NHS in England. Not that it's any better, you understand, but at least it's not as bad. The medic insisted the Scottish Government must take this situation seriously and show greater willingness for increased investment in core general practice services to maintain stability. And as well as a concerted action, he says, to recruit more GPs, there must be also action to retain the existing ones who are working to bursting point. They cannot take it. The stress level on these guys is immense. You just think you're a bit ill and go and see a doctor for 10 minutes, but he's dealing with that bang, 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 bang all day, every day. And they just don't have time to scratch their arse between patients. Patients are having important medical conditions, severe, grave medical conditions, missed. Not because the doctor is missing them deliberately, not because the doctor is not capable, but because the doctor is so understressed. He's so pushed to the very limits that he's dealing with one thing and he's maybe not seeing something that should be obvious, but because he's not allowed by the rules to treat two things at once, for example, he's incapable of dealing with these things. This is not the doctor's fault, and I'm going to stand up for them. This is the whole system. It is a systemic failure, and that system is run by the SNP and has been since forever. For 16 years it's been under. The NHS in Scotland has been there before the Scottish Parliament. It was always its own system, but ever since the SNP takeover all those years ago, 16 years ago, it has crashed and fallen and gotten worse every single year. Then Humza will come up and say, oh, well, in this particular, and he will cherry pick some tiny little thing where something's slightly improved to try and spin it like something's happening. But in actual fact, generally, it's got worse every year, and it's only going to get far, far worse if a quarter of all doctors quit. Now that's that. Now there's a lot more to this. You can see I can go down. I'm not going to go down. What I am going to do is, at this point, I'm just going to jump over to this, which is the other story. The number of people dying as a result of the NHS crisis in Scotland has doubled in just 2 years. In fact, it is way more than doubled. The number of people who've passed away after waiting more than 4 hours in A&E. In other words, they attend hospital, they've got an issue, they're supposed to be seen within 4 hours. They're not seen within 4 hours and they die because they're not seen. They're sitting in the waiting room and they die. And that has doubled in 2 years, according to information obtained by the Scottish Conservatives. Now, it's actually way more. The SNP are allowing people to die unnecessarily and needlessly, as the number of people who have passed away after waiting more than 4 hours in A&E doubled in 2 years. Now, this tells you that there isn't enough medical staff in A&E. How do you solve that problem? You put more medical staff in A&E. It's as simple as that. You stop wanking money away on independence brochures and on spin doctors, and you hire doctors and you hire nurses. The data obtained by the Scottish Conservatives under the Freedom of Information laws, and it's amazing that you have to go through a Freedom of Information Act rather than actually having these details published, which is what should happen, showed the number had increased, not doubled, but nearly trebled, by 164%. Doubling is 100% increase. It's 164%. It's getting up to nearly 3 times the number. In 2018, 281 patients died after waiting in excess of the target response time. But by 2022, that figure had increased to 743. The Scottish Conservatives warned the true death toll could be far higher, pointing out that 4 health boards did not reply to the party's Freedom of Information requests because presumably they were too embarrassed by it. So the SNP are sitting there, and through their policies and their inaction, they are deliberately allowing people to die. This is how bad the SNP are. They cannot control and run their own health service. The health service that they scream is fantastic and wonderful. And people are dying in corridors after not being seen within 4 hours of attending a hospital. It is just wrong. It is immoral, isn't it? It's a crime against humanity. The health boards which declined to give the freedom of information requests were Greater Glasgow and Clyde. No surprise there. We all know how bad they are. We've done several stories on that, and I am hoping to do another couple. There's another couple of people I'd like to get on and do an interview with, and I'm working towards that. There's Ayrshire and Arran, Grampian, and then Lanarkshire. The figures from the 10 health boards in Scotland that did respond showed that a total of 1,965 people died after waiting more than 4 hours in an A&E across the time in question. This is unacceptable. It has got to be illegal. It's got to be a crime against humanity. Scottish Conservative Shadow Health Secretary Dr Sandesh Gillane hit out at the SNP over the tragic and ultimately avoidable deaths. He said after 16 years in government, the SNP are clearly out of ideas when it comes to fixing issues in the NHS. And again, I'm not going to go into it anymore, but it's just giving you the flavour of what is desperately, desperately wrong and getting way, way worse. But they have had an idea, and this will come as anathema to the SNP because there is a get out for them, and they're going to be forced to do it. Because despite them saying about how good they are, how marvellous the SNP is, and how brilliant everything is under the SNP, and how an independent Scotland would be absolutely fantastic, the people of Scotland want to be glad that they're not independent. Because, boom, Scots could soon be receiving healthcare in England due to the Scottish Government failures. In other words, it's got so bad in the NHS in Scotland that they're actually going to transfer patients down into England that does have capacity, that does have the ability to look after them. Now, that alone should indicate to everyone that independence is not a good idea. Because imagine Scotland was independent. They couldn't just farm these people south of the border. It just wouldn't be there. It wouldn't be a thing. That is how awful it's got. And so if anything, if you are an SNP voter, and I know that some people who are SNP voters watch this channel, if you are an SNP voter, consider this. If your granny goes into hospital and doesn't get seen within 4 hours and dies, that's a bad thing. But imagine she does go into hospital, but they just literally don't have the capacity to do it, but they can shift her down to England. Would you want that? Would you save her life by shifting her to England? And then ask yourself this. If you were independent and knew that couldn't happen, Granny would be dead. How does independence sound now? Anyway, the UK's Health Secretary said he would consider appeals for people waiting for lengthy periods in Wales and Scotland to be treated by the NHS or independent providers in England. In other words, England standing up and fixing the mistakes of the likes of the SNP and Welsh Labour. Because these small-minded nationalist beaters of the hatred drum cannot sort out their own NHS system. Scots could soon be treated by the NHS in England as a result of the Scottish Government's lack of progress in tackling wait times. Health Secretary Steve Barclay has invited his Scottish and Welsh counterparts, Michael Matheson and, I don't know, Ellen Ed Morgan, I don't know how you pronounce that and I apologise if I get it wrong, to discuss what lessons can be learnt from varying approaches to the health service in different administrations. Well, the lessons are this. Don't have a health service run by the SNP in Scotland, because it will fail, because everything has got to go through the lens of independence, and money wasted on all these brochures, millions a year wasted on paying staff to work towards independence, £100,000 a year on a Minister of Independence, money that could be put into the NHS, that could hire a doctor, could hire a nurse, but no, wanked away with their single-minded cause of hatred and division. But hey, it doesn't matter if a few Scots die so long as they get independence. That's how the SNP mindset is. He suggested he would consider appeals for people waiting for lengthy periods in Wales and Scotland to be treated by the NHS or independent providers in England. Mr Matheson suggested the UK government should focus on the many issues south of the border. So there you go. Now listen to that. He's had an offer to take Scottish patients south to ease the burden on the Scottish NHS. And he said, oh, I bet England sorted out their own problems rather than trying to help us. So Matheson is directly causing the death of people by refusing to engage to get people put south of the border to be treated because he would be seen as a failure on him. He'd rather people died than accepted help from England. Are you still wanting to vote SNP when it's your granny dying so that Matheson can look good? These people are unbelievable. I'm going to stop and I'm going to come up because it's going on a bit, but it's spectacular. The level of contempt that the SNP has for people, that they are quite willing to let them die rather than accept help. Because it would be seen as, oh, it's help from England. Now, it's better if a few Scots die rather than getting help from England. Official SNP policy, that. Coming up. I'm going to suggest that if you were in a position where you could accept help and aid and medical care that could save lives, and yet you refused to allow that, I would suggest that is the grounds for arrest and for charges to be laid and for you to go to court charged with crimes against humanity. Failure to provide basic health care breaks the human rights, convention, and that makes it a crime against humanity. Michael Matheson needs to be charged, as well as all the other members of the SNP, because they're all in on it. The whole of the SNP need to be arrested and charged with crimes against humanity. They are in breach of the European Convention on Human Rights, which insists on seeking medical aid when necessary and where possible. That's the people who are running Scotland. Basically, criminals. War crime. If it happened during war, they'd be Nuremberged. There'd be a war crime. It's a crime against humanity. It needs to go to that. They need to go to The Hague. They need to be spending the rest of their lives in prison. And it sends a message to anyone else who gets in that position that you don't do what the SNP are doing. This is how bad and serious it is. And it is absolutely no wonder that a quarter of all doctors in Scotland want to quit the Scottish NHS. I don't blame them. Why would you work for an organisation that has no respect for you, that doesn't want to fund you, that could ease your levels of work, but who choose not to, and who are quite happy, your employers are quite happy to let people die rather than help them? Dying for a cause. I'll stop there. Thank you very much for watching. If you like what you're seeing here on the channel, please hit that subscribe button. And on this video, please hit the subscribe button, but definitely hit the like button. I want this video to go viral. Everybody needs to know what is going on in the NHS in Scotland. Everyone has got to see the facts, to see how bad it truly is, and to consider their choices when next they vote. Thank you. Until next time, stay safe, stay well, and for heaven's sake, don't go to hospital. Bye.